Is buspirone effective for social anxiety? Have you ever wondered if there is a medication that can help with social anxiety without the risks associated with other anxiety treatments? Today, we are going to look at buspirone and its effectiveness for social anxiety. Buspirone is primarily used to treat generalized anxiety disorder. It works differently than many other anxiety medications. Instead of being a sedative, buspirone acts on serotonin receptors in the brain, particularly the serotonin 1A receptor. This action helps regulate mood and reduce anxiety. When it comes to social anxiety disorder, also known as social phobia, the research is a bit mixed. Some early studies showed that buspirone might help reduce symptoms of social anxiety. However, a more rigorous study that lasted 12 weeks and involved a double-blind, placebo-controlled setup found no significant difference between buspirone and a placebo. In this study, only a small percentage of patients reported feeling better while taking buspirone, and the overall response rate was similar to those taking the placebo. One important aspect of buspirone is its safety profile. Unlike benzodiazepines, which can lead to dependence and addiction, buspirone does not carry a significant risk of abuse. This makes it a safer option for individuals who have a history of substance use disorders and need help managing anxiety. Buspirone does not cause sedation or euphoria like some other medications, which lowers the potential for misuse. However, there is still a small chance that someone with a history of substance misuse might try to misuse buspirone in search of euphoric effects, although this is uncommon. In practical terms, buspirone can be part of an anxiety management plan for those recovering from substance abuse. It is especially useful for those who want to avoid addictive medications. However, its effectiveness for treating social anxiety specifically is less clear. Because of the limited evidence supporting its use for social anxiety, it may not be the first choice for treating this condition. Healthcare providers often weigh the benefits and risks carefully, considering buspirone's favorable profile for addiction but modest effectiveness for social anxiety symptoms. In summary, while buspirone is not strongly supported as an effective treatment for social anxiety disorder, it can still be a helpful option for managing anxiety in individuals recovering from substance abuse. Its low potential for addiction and ability to reduce anxiety symptoms without sedation make it a medication worth considering in certain situations.